It is Wednesday, September 16th. Welcome to the Kahnawà COVID-19 Task Force Update. This is our 129th program, and today, normally on Wednesday, we are not broadcasting, but today there are some developments. We shall invite back an old friend who hasn't been here for a little while, but we'll start off with the big announcements, and Lloyd Phillips, who is of course the Commissioner of Public Safety, is here to start. Lloyd?
Thank you once again, Joe. 129 episodes, is that what it is? Wow. Certainly it's been a long road. It's as of Sunday, I believe it was officially 6 months since a pandemic was declared by the World Health Organization. And as we know, it's been a long road, throughout the months of March, April, and May. We were basically in a full lockdown, and then throughout the summer, things gradually got better. We start reopening economies and allowing gatherings, and more things have gradually opened over the summer. And throughout midsummer, we were in somewhat of a maintenance mode. We're somewhat of a lull in terms of the overall pandemic. But as we reminded you many times that we were still in a pandemic. There is a first wave, and it kind of peaked, and we talked about always bending that curve and ensuring that the cases that are diagnosed don't skyrocket, but rather if you have it on a wave or a graph that is more slanted in the healthcare system and can deal with it, and the cases can be dealt with properly, rather than having a wave where we seen at one point in time where the cases were put on a graph and it was almost shooting straight up. So things have evolved, things have changed a lot, and then over the summer, like I said, we were in somewhat of a low point, where we've seen the number of cases were around 50 at one point in time for a number of weeks. Then they gradually start creeping up, to the 100, and then 200 per day. And today we're in the neighborhood of 300 cases new just today. That's obviously throughout the whole province of Quebec. And in Quebec, they have increased their alert for the Montérégie South Shore region, as well as Montreal and Laval, to what they have is yellow. They done that yesterday. As I spoke yesterday, we were assessing that. We have received additional information and assessment with the task force input from Dr. Gauthier, and we have also decided that now is the time for us to implement, I guess, the first part of our plan, in which we call the increased vigilance phase of the pandemic. Because at this point in time, it has to be said that we are in the beginning of a second wave of a pandemic. There is no clear formula, there's no clear definition on when a first wave ends, when a second wave begins. But as said months ago, you're in a second wave, only after it's very clear that you see the stats and you see what happened and you see the trends. So we are comfortable here to inform you officially that we are in the beginning of a second wave of the pandemic. It is earlier, to be honest, than people anticipated. It was anticipated to be later in October into November, but unfortunately we're seeing those trends in the direction of a start of a second wave. Now, I'm here today to sound the alert, just to make sure people understand where we are in this whole scheme of a pandemic. We're not here to instill fear or anxiety in the community, but we also have to be fair and honest with the community. And that's why we're here today to announce that we are moving the task force into a heightened vigilance phase, which basically at this point is we're going to be changing our messaging a little bit. We want to make sure people are very clear what is requested of them. We want to make sure it's very clear that people understand the measures that are in place. And if people have been somewhat laxed over the past while in terms of adhering to various measures and directives, now is a time for us to reevaluate our personal behaviors and take that very seriously and take the measures strongly, because the actions that we do today and over the next few weeks will determine the extent of what happens down the road. We want to sound the alert now so that we don't have a critical state down the road. And the biggest single factor in that is how we conduct ourselves on our everyday lives. We do have a lot of measures in place since last March, as you know, and many of those measures remain in place. The businesses and such have complied greatly, have put measures to protect the employees and staff and community as a whole, and we had no cases as a result of opening of business. So we're very lucky, and we're very glad that turned out the way it was planned to roll out, and we will continue to be vigilant on those areas. At this point in time, we're going to be doing, again, heightened awareness. We're going to be assessing very closely what's happening around Kahnawà, and more importantly, what's happening within our community. We're not looking at this point in time to roll back any of the measures. We're not looking at this point in time the need to take any drastic decisions. But Arnold will be here in a minute to update on some of the important steps that we felt are important to take as of today, and he'll expand on that in just a little while. But we are confident that moving forward, if we as a community remain vigilant, remain compliant, that we could have the same result as we had during the first wave. Only with the cooperation of everybody involved were we successful during the first wave. And as I stood here 6 months ago and said to the community, if we look back in 6 months from now and we said that there was no deaths in our community, that we did our job. And I'm very happy to say 6 months later, we had no deaths in our community. And that's a large part because of the community spirit that we have. Despite many of our differences at times, when our community is in a crisis, when our nation's at a crisis, we all pull together and we understand what's most important, and those are the most vulnerable people in our population, our elders. And we respect them, we cherish them, and that's what we are doing this for, to ensure that they remain safe. And as well, we have to keep the entire community safe. Just because somebody is not an elder, it doesn't mean that they're immune to this virus. People still have gotten sick. People still have gotten very ill outside the community. And unfortunately, there was even some people who had died from COVID-19 who normally people thought they would be survive quite easily. So it's important for us to remember these things. And again, I raise this with you in the community, not to instill fear in no way, but again, just to remind the people of where we've been. And we're not quite sure, to be quite honest, where this is going to lead. Beginning of a second wave, it could be a small ripple. And we're hoping that's what the case is going to be. We could be vigilant, we could be compliant, and get through this relatively unscathed. If things don't go well, if people are not compliant, if things go off the rails, so to speak, we could see ourselves down a different path. But with the cooperation of everybody, like I said, I am confident that we will get through this once again, and this hopefully what will be a ripple, is not going to be a major wave like we've seen in previous months. But with that said, there's also some discussion on with the Chief and Council on the state of emergency. So it will be going back to the council table on Monday morning with the recommendation that the state of emergency is extended for a period of another 30 days. And again, at which time we are obviously always going to continue to monitor the situation and make appropriate decisions as we move forward. No, the biggest single thing, and I'll repeat this before I leave and let Arnold speak, again, is our individual actions. How we conduct ourselves on our day-to-day activities is what's going to determine the extent of a second wave. We're hopeful that, again, it'll be a minor inconvenience to us in the big scheme of things. Nobody wants to go down the path we've seen in March and April, but we also have to keep in mind the steps that we are taking is for the health and safety of our community first and foremost. I look at other jurisdictions and the way they're handling things, including Quebec, and it seems that they are putting the economics before the health of people. And that's something that the task force in our community will never do. So the health of our people are primary, and they will always remain primary. It was that since March, and it will continue as long as we have to. So with that, I'll let Arnold step in and speak on a couple of measures that were taken immediately. Now we'll go.
Thank you, Lloyd, and good afternoon, Kahnawake. Today, I'd like to focus on a few items. One is I'd like to look at the positives. At a time when things can easily go wrong, I think it's important that we identify the positives that we've done. As Lloyd mentioned, 6 months, we have no hospitalization and no deaths. That in itself is I think the paramount statistic. And as Lloyd mentioned, that's due to the community support. Without the community support, we would be a very different place. When it was started, we had started going 2 weeks at a time, and then we said we'd go a month, and here we are 6 months later. What have we learned? We've learned that the community is able to put in items that will help slow the spread down. Okay, it was mentioned earlier that the disease doesn't move unless we move. And Kahnawake has been really good in accepting the items. If you take a look at the masks issue, what could have been a very controversial, it is a controversial issue in other jurisdictions, Kahnawake has acknowledged the importance of it. And I think that's partly because the task force has tried to educate people as to why it's important. We're not interested in saying, do it because we say so. We want you to be aware of the rationale for it. So we do know that the masks reduce. We do know that the social distancing is effective. And we know that sanitization of the hands is very important. Those 3 items have been giving us the excellent results that we need, and we need to continue. Now, we'll address the schools. People are saying we need to look at, while there's a resurgence, once again, based on what we know, the guidelines that we implemented, and weighing the risk versus reward, the students will benefit by going back to school. I think it's important to note that the media is saying there's 240 cases, but what they're also not saying is there's not been one cluster within a school. The clusters that started came from outside the school. It was not within the school that it was transmitted. The student either went somewhere and got the virus and brought it to the school. So that's one of the things that we need to be clear. and we're looking at the science of it. Now, if we were aware that there was a contagion within a school, then appropriate actions are going to be taken. But we're really looking at the science of it. And right now, there has not been, through the contact tracing, there's no contagion from kids being in school. They brought it in. So that's something that we need to keep monitoring, and we will keep monitoring. One of the items that we have is we have the benefit of knowing the history. Back in 1918, when the Spanish flu hit, the first wave was bad, but it was the second wave that really did more damage because people either weren't aware or got complacent, and the second wave did a lot more damage. We have that knowledge. So we're way ahead of 1918. So we are continuing to move forward, and we need to ensure that we're following the guidelines that we put out. More recently, we've had several requests, and this is the announcement that we're making when there was a request to increase the number of people in buildings. It's currently at 50, and it's for public, and it's currently at 10 for private residences. Now, we've had a request to increase it. At the current time, we find that it would be not consistent to increase the numbers in the public venues and in the private venues. We want to see what's going on. Now, once again, that's a very different circumstance than education. They have been taking super precautions. The teachers are fully aware that their responsibility has been increased, and Kahnawake being Kahnawake, the staff have stepped up to the challenge, and we're confident that they will be able to deal with it. We have had, in the plan, the original plan, it was to increase the number of people in the gaming institutions. Well, that increase is going to be delayed until we find out what happens around us. So while there was supposed to be an increase in the gaming, they have been informed that it's not a great time, and as a result, the increase in gaming numbers is going to be on hold. Once again, coming down to the safety. We have received requests for individual businesses to increase their hours of operation. Now that is going to be handled on a case-by-case issue, because we know that the hour does not provide more of a risk to the people. It's the number of people in the building. So individual requests for extending hours will be made, and naturally it will be monitored closely. We continue to be monitoring. One of the questions that came in today was, I have people that have to come into my house for different services. Is it safe to proceed? Now, we're entering fall, and the fire brigade will recommend that people get their heating sources checked, furnaces, wood stove, chimneys, etc. We need to move towards a new normal. So yes, it's okay to move ahead with these services. Now, once again, we're going to say you can move ahead, but what are the three basic components that need to be followed? Social distancing, masking, and hand sanitization. So we're confident that if people move ahead, it's safe to get their furnace serviced. And I have 3 houses that I assist with. As a fireman, I want to make sure the furnace is working properly. We've invited the technician in to safely service the furnace, because once again, carbon monoxide, there's a whole list of items that I'm sure the fire brigade is going to be coming out in October for Fire Prevention Month. So we need to move towards this new normal, and that includes continuing with our lives. Now, it's important to note why we're in such a high risk. Kahnawake is doing very well, but around us, we're at 300 people per day. And our community members are going to the various businesses where these other people are. So it's all the more important that we become hyper vigilant. Just to end, Kahnawake has been doing very good. We've been relatively fortunate that our numbers are where they are, but it's true continued vigilance. And that's what's going to save us. We do know that all of the major outbreaks have been due to social gatherings. And if we look at what's happened over the last few weeks, it's been warm, so the gatherings have taken outside. As the cold weather gets here, there's going to be a tendency to move indoors, and that in itself is a risk. So once again, we need to continue to respect that 10-person family rule, because that will go far. We don't want anybody to be sick. We don't want anybody to get blamed. And once again, if something does happen, we want to avoid the blame game. I don't think anybody is actively going out to get the COVID. And if anybody does it, it's purely not on purpose. But so all the more reason that we need people to be hyper vigilant, wash your hands, wear a mask, and stay 6 feet away. And to quote a good friend of mine, it says, if you're sick, stay the heck home. Have a good evening, Kahnawake.
Thanks, Arnold. You know, we've been doing these programs now, what I say, this is our 129th program. And I know on occasion, we have people have made note and in some instances kind of joked about, well, you guys, you're washing your hands too much. You can't wash your hands too much. You go to a store, every store has a dispenser. Use it. Coming in and going out. Every store has a rule about masks. Just follow it. Of course, now if you go outside and you don't, you could get fined. In Kahnawake, we haven't had to resort to that because people have been following the rules. So we're very fortunate that way. Let us ride out the wave and continue to do what we're doing. As we've stated before, the task force is not here to rule, that's for sure. The task force is here to make sure that you have the information that you need so that we're all well protected. And every community member has a role to play. Let's hope that we all do. So on behalf of all of us here, we'd like to thank you very much for watching, and we shall see you tomorrow. Go Adano, Onigiwahi.